Sleep is something that's so very easy for so many of us to take for granted, but boy, it's significant importance to your health. And if you don't believe that, just go without sleep for any period of time and you will feel the effects very quickly. Wanted to learn more about sleep, and so I started using an app called SleepScore, and it really captures some pretty interesting data, which led me to want to learn even more. So that got me in touch with the developers, SleepScore Labs, and they linked me up with our guest today. He is Dr. Nate Watson, the co-director of the University of Washington Medicine Sleep Center in Seattle, and he is with us via video conference. Nate, good to have you here.
Good to be here.
So tell me more about how you sleep differently, or maybe what you do differently because of what you know than what the rest of us might be doing.
I think the main thing is that I really prioritize sleep in my life. I go to bed when I feel sleepy. I try to get at least 7 hours of sleep a night. Mm-hmm. And I have consistent bedtime routines that help me fall asleep. I realize now, there's no substitute for sleep, and sleep impacts nearly every aspect of my functioning. And I know that if I get the proper amount of sleep, that I'm going to be the best version of myself.
So what's going on in our body while we're asleep that makes it so critically important to our health?
Well, there's a lot of things going on. We have an ultradian rhythm that happens when we sleep that takes us through all these various sleep stages. Sleep is divided essentially into what we call REM sleep and non-REM sleep. REM sleep is when we dream predominantly. That's about 20% of our night. And then non-REM sleep makes up the rest of the night. Non-REM sleep has 3 stages, N1, N2, and N3. We spend most of our nights in N2, but the most important stage is going to be N3. And that's the part of sleep that kind of restores our body. It's when growth hormone is secreted. So, that's kind of the crucial element of that stage. REM sleep helps with memory consolidation. And so that's, one of the many important elements of that stage. So that's really, what's going on. There's another important element that we now know, which is during sleep is kind of when the brain takes out the garbage, if you will. There's something called the glymphatic system in the brain. The brain contracts a little bit when we sleep, and it allows cerebrospinal fluid to flow freely and kind of flush out all the byproducts of a day's worth of brain activity. And so obviously that's a crucial element of what sleep does for us as well.
Yeah, I'm glad you mentioned that. I saw that report come out just a couple of weeks ago and wanted to make sure we talked about that. Now, does that happen during the deep sleep phase? Is that when that's occurring?
Yeah, it's predominantly in that N3 sleep, that really deep stage of sleep, which is probably the most important sleep stage, because if you sleep deprive yourself, that's going to be the stage that your body's going to get back as quickly as possible, or prioritize when you go to bed the next night. And so, that along with these other aspects of, growth hormone secretion, it being important for body repair, and for this notion of clearing out the byproducts of a day's worth of thinking from your brain, kind of all make that a very important sleep stage, which most of us are going to spend anywhere from 15 to 20% of the night in that sleep stage, N3.
So how do I get more of that sleep? So we'll talk about the app and how it tracks phases in just a minute, but if I want to increase that deep sleep phase, what can I do?
Well, there are some medications out there that are thought to perhaps increase this sleep stage, but of course there's no medical indication to take these drugs for this purpose necessarily. And so really, I think the best way to maximize the amount of N3 sleep that you get is to maximize the amount of healthy sleep you get. And then your body will obviously, go ahead and put you in that stage for the proper amount of time. It's an interesting question because, we know that it reduces as we age. And of course, we talked about the association with growth hormone and that, so there may be some aspect of decreased N3 sleep, decreased growth hormone might be a part of the natural aging process. which raises questions about whether or not to try to externally influence these things. There's really no consensus in the medical community or in sleep medicine per se that taking medications or doing anything to increase it has any effect one way or the other.
So the app itself tracks how much time you spend in each one of those phases of sleep. How does it know what phase of sleep I'm in?
Yeah, so we were actually involved with the development of the SleepScore technology here at the University of Washington. And basically what it does is it turns your phone into an active sonar, somewhat like a bat, perhaps. So you have 18 to 20 kilohertz signals being emitted from the phone. You can't hear that, but those sound waves reflect off you when you sleep, and then they're received back at the phone. So what the phone's able to do by virtue of that is to determine whether or not or how much you're moving in bed. Mm-hmm. But not only that, your respiratory rate and the depth of your breathing and the regularity of your breathing. And so we know, for instance, when you're in that deep non-REM sleep or that N3 stage of sleep, that your breathing gets very regular in that sleep stage, as opposed to REM sleep, where you're breathing as if you're in your dream. And so your breathing gets somewhat irregular, much like it might be during the day or as our breathing is right now as we're having this conversation. And so the app can differentiate between sleep stages based on those factors, along with gross body movements. So it's really assessing different aspects of your movement in bed in order to determine sleep stages.
So even though I'm under blankets, it's able to tell what my breathing pattern is? That's fascinating.
Yeah, I mean, it picks up very subtle movements. And so, yeah, it can pick that up. And you don't have to concern yourself with whether or not you have a bed partner or your family pet is in the bed with you as well, because the phone can differentiate people based on their distance from the sound emitting device or the phone at your bedside. So that's not really a problem either. Of course, SleepScore Labs, the company that produces the SleepScore app now, they have sophisticated algorithms that they've developed over a decade by virtue of a radio frequency device that they also have created in order to make this device as accurate as possible.
So am I using this app correctly? I mean, I'm monitoring what my sleep is doing, and then I'm sort of altering my lifestyle habits. So I track if I sleep well, how much coffee have I had that day? How much exercise have I had? Is that the right way to use this app, Modified Lifestyle, to get a higher sleep score?
Yeah, it is. And I think that's the beauty of this. You know, in sleep medicine right now, we can only really assess sleep for one or a couple of nights in a highly controlled environment in the sleep laboratory, which we know is not representative of a typical night sleep. And so what the app does is it allows us to measure sleep in the typical sleep environment, which is really important, and longitudinally over days, weeks, years, and further. And so what it allows the consumer to do is to, like you just said, make changes in their lifestyle and then assess what impact that's having on their sleep score in order to assess whether or not that behavior is improving their sleep or making it worse.
Yeah, it's been interesting to track. I don't know that I found the right formula yet, but still, it's an input tool, right? So you can modify behaviors. I think that's pretty interesting. So we have to take a break, but when we come back, we're going to take a look at exactly what's happening during apneic sleep. If you have sleep apnea and you sleep with a CPAP, as so many people do, we're going to get into that, as well as see what Dr. Watson thinks is the biggest discovery in sleep so far this year. So all that's coming up on Health Call Live here on WOWO, 1190 AM and 107.5 FM. Welcome back to Health Call Live. We're taking a look at sleep, how important it is in your life, how you can track it using an app called SleepScore. and learning more about sleep with a specialist. Dr. Nate Watson is the co-director of the University of Washington Medicine Sleep Center in Seattle. He is with us live via the video conference right now. And we'd like to have you as a part of the program. You can always listen to this podcast wherever you get your podcasts, or you can go to the HealthCall Live webpage and you'll see the video version of the interview there in just a day or so. So, Dr. Watson, let me get back to you. I want to find out now about sleep apnea. So that is when your breathing is interrupted, sometimes hundreds of times per hour through the course of the evening. If that prevents you from getting into deep sleep, that you told us earlier, you may not be getting the growth hormone that you need and some other things happening. So what is the impact of apneic sleep and then sleep with a CPAP?
So sleep apnea is incredibly common. It affects probably about 10% of the population. And, right now, about 80 to 85% of people that have it are undiagnosed and untreated. So I think that's the first thing to understand about this. If somebody tells you that you snore, you stop breathing in your sleep, if your sleep is disturbed at night or you're excessively sleepy or fatigued during the day, these could all be indications that you may have a sleep apnea problem. And it's a big issue. I mean, if sleep apnea is severe, it's associated with increased mortality, and really sleep apnea of moderate levels as well, moderate and severe levels, even milder levels are associated with cardiovascular diseases and diabetes, mental health issues like depression, and it reduces your mental performance too. So has a lot of bad impacts on a person's functioning during the day. And essentially what it is, it's quite simple. It's just repetitive episodes of airway collapse occurring at night when people are sleeping. And so it's somewhat insidious. I mean, people often won't know that they have it unless somebody, comments on observing them having difficulty breathing at night.
Well, some of the symptoms are if you wake up consistently with headaches, daytime drowsiness. There are a lot of symptoms you can find if you go look online. How effective is a CPAP? If I'm sleeping with a CPAP, am I getting the quality of sleep I need, or is it never just going to be quite right?
Yeah, I mean, CPAP works great. It's definitely the best treatment that we have for sleep apnea and has been for a long period of time. Mm-hmm. And it can, essentially normalize a person's sleep. And so it's very effective at what it does. And, it involves a mask that you have to wear on your face, connected by a tube to a small box that sits at your bedside. So it can take a little bit of getting used to. But, I've had many patients who are perhaps reluctant to use it, but once they began to sleep with it on, now they won't go to bed without it.
Yeah, I've heard compliance rates, though, can be fairly low. As much as 30% of people eventually step away from their CPAP. And I get it. It's the best thing that you've got going for you, but it's still not a great solution. Hey, so, there's a lot of talk these days about making sure that you wake up at the right time. And by that, I mean not by the clock, but by the sleep phase that you're in. What is the correct phase of sleep that we should be awakening from?
Ideally, a lighter stage of sleep. So we talked about non-REM and REM earlier. So we'd be talking about really non-REM sleep stages 1 and 2, or even perhaps REM. It's really more about the sleep stage that you don't want to be waking up out of, which is stage N3, or that really deep stage of non-REM sleep. Because what people experience in that circumstance is something called sleep inertia, where they'll be really groggy, they'll have difficulty, clearing their mind and getting up and getting alert. And it just takes a while to get yourself going when you wake up out of that sleep stage. So, SleepScore has a smart alarm, which, can detect, the sleep stages that we discussed earlier that would be more appropriate to wake up out of. And then, you can set a window of time upon which you want to wake up. And then the app itself will, emit the alarm when you're in one of these lighter stages of sleep.
Yeah, I haven't gotten to that yet. Is that part of the free app, do you know, or is that part of the paid portion of the app?
I believe it's part of the free app.
Oh, well, then I better check that out and start using it, huh? I love this question, and that is, should I be sleeping with a fan or a sound generator? So many people do these days. Is that a good thing to do?
I think that's a part of personal preference and somewhat defined by your sleep environment. If you're sleeping in the country somewhere and there's not a lot of extraneous noise, then it may not be an issue. But if you're sleeping in a more urban environment where there are a lot of extraneous noises around, having a white noise machine or a fan or something like that can help drown out those spikes in noise, which have a tendency to wake people up.
What about a radio next to the bedside? You know, we're a talk radio station. We have a lot of people listening overnight. Is my brain registering all of that, or is that detrimental?
It's not registering it, and whether or not it's detrimental probably is individualized. It might not be a problem for everybody, but generally speaking, when we think about good sleep hygiene, we wouldn't want somebody to have a radio on or a television on because those things are activating and they can work against sleep onset.
Got it. What about Ambien? I know that it is a drug that can have a significant impact on people. If I have to use Ambien to get to sleep, you're only supposed to be on that drug for, I think, 6 weeks at a shot, right? If I have to use Ambien, what alternatives do I have?
Well, the first thing is that insomnia is both a symptom and a disease. And so before we would treat it as a disease, we would want to explore whether or not it's a symptom of something else, such as obstructive sleep apnea, as we mentioned earlier. I mean, insomnia is a very common symptom of that. It's also, a symptom of depression. And so you would want to get to the root cause of that rather than treat the symptom per se. Now, in the instances where insomnia is the disease, there's something called cognitive behavioral therapy for insomnia, where a trained individual will teach a person how to manage their insomnia complaint. And essentially, we know that it works as well, if not better, than medications long term to treat the problem. So that would always be our first recommendation. Of course, one of the challenges with that is just access to professionals who can do that therapy. But be that as it may, would be the best approach in order to avoid Ambien or other sedative hypnotic medications.
Got about a minute left for you, Doc. What is the most significant discovery around sleep that you've heard of recently?
Well, we have 2 new medications that have come out this year that are stimulant medications to treat a disease called narcolepsy. And actually, one of them also can treat residual sleepiness and sleep apnea, patients that are treated with CPAP who have residual sleepiness. So that's called solriamfetol or Sunosi, that one. And then there's another one called pitolisant or Wakix. And so these are 2 new medications that we have at our disposal to treat patients with sleep disorders. And I think that's a pretty exciting development for our field.
So you would need to speak to your physician about that if you're having that problem. Hey, I sure appreciate your time. Thank you very much. Dr. Nate Watson is the co-director of the University of Washington Medicine Sleep Center in Seattle. He's been with us by video conference today. We're talking more about an app called SleepScore that I endorse. It costs you absolutely nothing, available on the Apple and Android platforms. And you can learn more about it if you just go online to sleepscore.com.